If you could only ask your doctor to check one thing to predict how long you might live, it might not be your blood pressure, it might not be your cholesterol, it might be something as simple as how hard you can squeeze. Sounds strange, right? But stick with me, because by the end of this video, you're going to look at your own handshake completely differently. I'm Dr. Anthony Fauci, and for years, I've sat across from patients who are surprised, sometimes a little offended, when I ask them to squeeze my hand or a small device during a checkup. They expect blood tests. They expect a stethoscope pressed against their chest. They don't expect a handshake test. But this simple measurement, called grip strength, has quietly become one of the most studied indicators of overall health in people over 50. Today, I want to walk you through what the research actually says, why this matters more as we age, what it can tell us that other tests sometimes miss, and, most importantly, what you can actually do about it, starting this week, with no special equipment and no gym membership required. This is a longer video than usual, and I did that on purpose because I wanted to give this topic the depth it deserves. So get comfortable, maybe grab a cup of tea, and let's get into it together. Let's start with where this all began, because grip strength testing wasn't always taken seriously in mainstream medicine. Back in 2015, a large international study published in the Lancet looked at nearly 140,000 adults across 17 countries on 4 continents. The researchers measured grip strength using a simple handheld device called a dynamometer. That's just a tool that measures how hard you squeeze. Nothing complicated about it, similar to those grip strength testers you might have seen at a county fair. What they found surprised a lot of people in the medical field. Grip strength was a stronger predictor of death from any cause, and specifically from cardiovascular disease, than systolic blood pressure, the number doctors usually focus on most during a checkup. Let that sink in for a second. A simple squeeze test outperformed blood pressure in predicting future health outcomes, in a study involving well over 100,000 people. Now, I want to be really clear about something because I don't want anyone watching this to panic. This doesn't mean weak grip strength causes heart disease. Correlation isn't causation, and the researchers themselves were careful to point that out. What they believe is happening is that grip strength acts like a window into your overall muscle health, and muscle health is deeply connected to how your whole body is aging. Your heart, your metabolism, your hormone balance, even your immune system. Think of it less like a single warning light and more like a dashboard gauge that reflects what's happening under the hood. This is where a term comes in that you may have heard before, but maybe didn't fully understand. Sarcopenia. That's just the medical word for age-related muscle loss. It sounds clinical, but the concept is simple. Starting in your 30s and 40s and accelerating after 60, your body naturally loses muscle mass and strength if you don't actively work to maintain it. According to research published by the National Institute on Aging, adults can lose somewhere between 3 to 8% of their muscle mass per decade after age 30, with that rate speeding up significantly after age 60. By the time someone reaches their 80s, without intervention, they may have lost a substantial portion of the muscle mass they had in their 40s. Grip strength happens to be one of the easiest, most reliable ways to measure how much of that muscle and strength you still have, because your hands, forearms, and the way your whole body coordinates a squeeze reflect a lot more than just your hands. They're connected to your nervous system, your tendons, and your overall muscular coordination. So why does this matter so much, specifically for people in their 50s, 60s, 70s, and beyond? Let's go through several areas where the research gets genuinely interesting, one at a time, so we can sit with each one properly. The first area is falls and frailty. A study published in the Journal of the American Geriatrics Society followed older adults over several years and found that lower grip strength was associated with a significantly higher risk of falls and frailty syndrome. Frailty isn't just a word doctors throw around loosely. It's a real, measurable condition involving weakness, slow walking speed, low physical activity, and reduced physical reserve, often assessed using a standardized tool called the Fried Frailty Index. And falls, as many of you probably already know either from personal experience or from someone close to you, are one of the leading causes of serious injury in people over 65, according to data published by the Centers for Disease Control and Prevention. The CDC has reported that millions of older adults experience falls every year in the United States alone, and a significant percentage of those result in fractures or head injuries requiring hospitalization. Grip strength testing gives doctors an early signal, sometimes years in advance, of who might be at higher risk, long before a fall actually happens. It's a bit like checking the tread on your tires before a long road trip, rather than waiting until you're already sliding on the highway. The second area is recovery from illness and hospital stays. There was a study published in the journal Age and Aging that looked at hospitalized older adults and found that those with weaker grip strength on admission had longer hospital stays and slower recovery times after surgery or illness compared to those with stronger grip strength. This makes intuitive sense once you think about it. Your body's ability to bounce back from any physical stress, whether that's a surgery, a bad case of the flu, or even just a fall, depends heavily on how much muscle reserve you have to draw from. Researchers sometimes refer to this as physiological reserve. Grip strength is, in a way, a snapshot of that reserve, measured in seconds, without needing any blood work or imaging. The third area, and one that tends to surprise people the most, is cognitive health. A study published in 2018 in the Journal of Alzheimer's Disease followed thousands of older adults and found an association between lower grip strength and an increased risk of cognitive decline over time. I want to be really careful here because this is still an area of ongoing research, and grip strength is absolutely not a diagnostic tool for dementia or Alzheimer's disease. Researchers don't fully understand the underlying mechanism yet. Some hypothesize it may relate to shared underlying factors like chronic low-grade inflammation, vascular health affecting blood flow to both muscles and brain tissue, or simply overall physical activity levels influencing both systems simultaneously. But the consistent association showing up across multiple independent studies is interesting enough that researchers continue to investigate it actively, including in some newer longitudinal studies that are still ongoing as of recent years. The fourth area is independence and quality of life, and honestly, this might be the one that matters most in your day-to-day reality. Research published in the Journal of Cachexia, Sarcopenia, and Muscle has linked grip strength to a person's ability to perform everyday tasks. Things like opening jars, carrying groceries up the stairs, getting up from a chair without pushing off with your hands, or even maintaining good balance while walking on uneven ground. These aren't abstract medical outcomes tucked away in a research paper. These are the exact, practical things that determine whether someone can continue living independently in their own home, or whether they start needing more help with daily activities sooner than they'd like. And there's a fifth area worth mentioning, one that's a bit less discussed but increasingly studied: bone health. A study published in the journal Osteoporosis International found associations between grip strength and bone mineral density in older adults, particularly in postmenopausal women. The thinking here is that muscle and bone are closely linked tissues. Stronger muscles generally place more beneficial mechanical stress on bones, which can help maintain bone density over time. This research is still developing, but it adds another layer to why maintaining grip and overall muscle strength matters well beyond just the muscles themselves. So at this point, you might be thinking, okay, this sounds important, but what do I actually do about it? This is the part I really want you to lean into, because the encouraging news here is that grip strength, unlike a lot of health markers we can't easily influence, is something you have real, meaningful control over at almost any age. Let's talk through practical, doable steps one by one. The first step is resistance training, and I know that phrase can sound intimidating, like you need a gym membership and a rack of heavy weights. You don't. A study published in the British Journal of Sports Medicine found that even light resistance exercises performed consistently 2 to 3 times a week led to measurable improvements in grip and overall muscle strength in adults over 60. This can be as simple as using resistance bands at home, doing wall push-ups, lifting light dumbbells while seated, or even regularly squeezing a stress ball or a hand gripper device. The key word researchers emphasize again and again in this body of research is consistency, not intensity. You don't need to lift heavy, you need to show up regularly. The second practical step is protein intake. Research published in the journal Nutrients has shown that many older adults don't get enough protein in their daily diet to adequately support muscle maintenance, partly because appetite naturally decreases with age, and partly because dietary habits formed decades ago don't always account for the body's changing needs as we get older. General guidance from organizations like the Academy of Nutrition and Dietetics suggests older adults often benefit from spreading protein intake across all meals, including breakfast, rather than concentrating most of it at dinner, which is a very common pattern in a lot of households. Simple sources like eggs, plain yogurt, Beans, lentils, fish, or chicken, spread throughout the day rather than loaded into one meal, can make a meaningful difference over time in how well your body maintains muscle. The third step, and one that's often overlooked, is staying generally physically active, even outside of structured exercise. A study from the journals of gerontology found that overall daily activity levels, including walking, gardening, and household tasks, correlated with better maintained grip strength over time compared to a more sedentary lifestyle. You don't need to become an athlete, you simply need to avoid long stretches of complete inactivity, which research consistently shows accelerates muscle loss faster than almost anything else. The fourth step involves something a little different: posture and hand-specific habits during everyday tasks. While research here is more limited and somewhat preliminary, some occupational therapy literature suggests that regularly engaging your hands in varied, functional tasks, things like cooking, knitting, gardening, or playing a musical instrument, may help maintain fine motor strength and coordination alongside general grip strength. This isn't a replacement for resistance training, but it's a reasonable, low-risk addition worth mentioning. And the fifth step is simply awareness and communication with your doctor. If you're someone who's noticed your grip feels weaker than it used to, maybe jars are harder to open than they were a few years ago, maybe your handshake has changed, maybe you've been dropping things more often, that's genuinely worth mentioning at your next appointment. Not as something to panic about, but as useful clinical information. Many doctors now incorporate grip strength testing using that simple dynamometer device I mentioned earlier as part of routine checkups for older adults, precisely because it's quick, painless, inexpensive, and genuinely informative. I want to pause here and say something important, because I don't want this video to leave anyone feeling anxious. If you're watching this and thinking about your own grip strength, or a parent's, or a spouse's, please don't let this create fear. The research here isn't meant to alarm you. It's meant to empower you with information most people simply haven't been told. Grip strength isn't a fixed number that only moves in one direction as you age. Multiple studies, including research published in the Journal of Strength and Conditioning Research, have shown that older adults, even well into their 70s and 80s, can meaningfully improve grip and muscle strength with consistent, appropriate exercise. This isn't a one-way street where decline is inevitable and permanent. Your body continues to respond to effort at any age, and that's genuinely one of the more hopeful findings in this entire body of research. Let me also address a question I get fairly often, which is whether grip strength differs meaningfully between men and women, and whether that changes how this information applies to you. Research published in the journal Age and Aging has noted that while average grip strength values do differ by sex, with men generally testing higher in absolute numbers, the relative pattern, meaning how grip strength relates to health outcomes within each group, tends to hold true for both men and women. In other words, this isn't a male-specific or female-specific concern. It applies broadly, and both men and women benefit similarly from maintaining strength through the strategies we've discussed. Another common question is whether grip strength testing is something you need a special appointment for, or whether you need to ask your doctor specifically. The honest answer is that practices vary. Some primary care physicians incorporate it routinely, especially in geriatric-focused practices, while others may not unless you bring it up. There's no harm in simply asking at your next visit, would it be useful to check my grip strength as part of my overall health picture? It takes less than a minute, and most clinics that have a dynamometer available are happy to do it. So if I had to summarize the practical takeaways from everything we've covered today, here's what I'd want you to remember walking away from this video. Simple resistance exercises a few times a week, using bands, light weights, or even just your own body weight. Spreading protein throughout your meals rather than concentrating it at dinner. Staying generally active throughout your day, rather than sedentary, even through ordinary activities like walking or gardening. Engaging your hands in varied, functional activities when you can. And mentioning any noticeable changes in your strength or hand function to your doctor, so it can be tracked over time as part of your broader health picture. None of these require expensive equipment, drastic lifestyle changes, or anything complicated or overwhelming. They require consistency, and they require simply knowing that this matters. Which, now that you've watched this, you genuinely do. Before I wrap up, if you found this helpful, it would mean a lot to me if you hit subscribe, because I'm putting out videos like this regularly, covering the research behind the health questions that matter most as we get older, the kind of information I wish more people had access to before they needed it. And if you have questions, or if this made you think of someone in your life, a parent, a spouse, a friend, drop a comment below. I genuinely read through them, and some of the best topics for future videos come directly from what you all are asking me. Taking care of yourself as you age isn't about chasing perfection or trying to reverse time, because none of us can do that. It's about understanding your body a little better than you did yesterday and making small, steady choices that add up over months and years. Your grip strength is just one small window into that bigger picture, but as the research shows, it's a window genuinely worth paying attention to. Thank you so much for spending this time with me today. Take care of yourself, take care of the people you love, and I'll see you in the next video.